Hi, my name is Vic. I'm an ENT surgeon working for the NHS in central London, and I want to tell you about ear infections. So I'm going to explain the two different types of the most common types of infections of the ear, so you can try and make sure you get the right treatment for those two different types of infections. The first is called otitis externa. That means this part here is the external ear, but also the ear hole is the external ear. So that ear canal skin can get infected. That's why we call it otitis, an infection of the ear area. Externa, otitis externa is the infection of the ear canal skin. So all the way down to the eardrum, which is I'll draw a picture here so you can see it here. So you've got the ear canal skin, all that area has become infected. Now, a different type of infection is not that area at all, but it's in the middle ear, it's in that middle area. And that's behind the eardrum, but not in that seashell thing, the cochlea, which has all the nerves that go off to the brain. We're talking about the space where all the little hearing bones are, behind the eardrum. It's also the space where it's connected to your nose, where you go like this on an aeroplane, your ears pop. And when you get that sensation that your ears are popping, the air is going through your nose into the ear through this little tube called a Eustachian tube. It goes through into your ear and equalizes the pressure between the outside world and the inside world. That's why the eardrum can sometimes get sucked in because you haven't popped your ears. Anyway, so there's an infection of that area, the middle ear. I'll draw this in this picture here, and also the infection of the ear canal skin. Now, the reason why I want to talk about these two is because they're very easily mixed up and people end up getting the wrong treatment. And I'll try and go through what symptoms each of these two different types of hearing infections give you so you know what treatment to get. The easiest way to figure out which infection you have, either an external ear infection or a middle ear infection, is to figure out what kind of pain you have. This is not always true. Sometimes people get different types of pain, but generally, when you have an otitis externa, that means infection of the ear canal, it is a very sort of slightly more sharper pain, but it's typically more painful, acutely more painful when you touch the ear, even that little bobbly bit at the front of your ear hole, or when someone pulls the ear like this. If you did that, you go, oh my God, that's so tender, don't touch that. Or when you push the ear like this, or if you push, one of those ear-looking things into your ear, and the doctor goes, oh, I'm just trying to look for something. If that's acutely painful and makes you want to cry with the pain, it's much more likely that you have an external ear infection. Now, when you do that to someone with an otitis media, that means an infection in the middle ear, you can look all you like. It's not comfortable, but it's not so acutely painful. I mean, with otitis externa, you can barely touch it, and you just touch it like this sometimes, and that's so painful that you can't tolerate it. With otitis media, it's not sort of like a surface type pain. It's a deep, boring pain on the inside. And you can touch your ear relatively easily without you wanting to scream in pain, but it's deep inside. Because what happens is that the infection is filling up that middle ear space and it's got nowhere to go. It doesn't go through that tube I was telling you about, the Eustachian tube, and it's trying to get out. What it ends up doing is pushing on the weakest element in that area, which happens to be the eardrum. So it's pushing the eardrum like this because when you start getting the infection, it gets bigger and bigger, like a pus ball. It gets bigger and bigger and bigger. It has to be discharged somewhere. The best place is down the Eustachian tube, down the back of your throat, and it's all gone. But sometimes it can't go down that tube because it's all blocked up for whatever reason. So it tries to start pushing on the eardrum, pushing it out this way. And when you pull on the eardrum, there's lots of nerves going to the eardrum. It hurts so much, but it's like a deep, boring pain rather than the pain that hurts when you touch it just like this. Figure out what sort of pain you have, and then you might be able to figure out what sort of infection you have. Another way to tell is based on hearing loss. Now, typically what happens with otitis media is that it fills up with this pus or fluid behind your eardrum. And at that point, it is not particularly painful, but you are getting this middle ear space filling up with fluid. It's only when it gets right to the top and starts pushing on the eardrum does it start hurting. But the first thing you notice typically is that a change in your hearing. Oh, it doesn't sound quite right. And you want to pop your ear and you sort of try and do this and all that sort of stuff. But you feel like you're losing your hearing on one side. It's a bit like some people say, like, I've got a head cold. Their ears feel a bit blocked and the sinuses feel blocked. It feels blocked in one ear, and that's ear you're getting the otitis media, the middle ear infection. So you tend to lose the hearing first, and then when it gets right to the top and fills up, it starts pushing on the eardrum, and then you start getting the pain. So hearing loss first, then the pain. On the other hand, with otitis externa, this is the infection out here in the ear canal, you don't stop your hearing at all at the very start. You get the pain first. It's like an itchiness to begin with and gets more and more acute. And then it gets really, really painful. Sometimes it gets so painful that it swells up so much that the ear canal, the hole, closes up altogether. And only then do you lose your hearing. So there's a real difference. It depends when your hearing loss occurred. Did it happen right at the start? Or did it happen right at the end when it got really, really bad, if that makes sense? Which came first, the pain or the hearing? Yes. Another feature of these infections is the discharge that comes out of your ear. The yellow, sometimes green, brown, bloody sort of discharge that comes out of your ear. And that is different for, again, these both different types of infection. Now, otitis externa, the ear canal infection, a bit like any infection. So if you've got an infection of your hand here and maybe you stripped off some of the skin in this area here, if it got infected, it'd be covered in this white yellowy stuff, and you'd want to give it a clean to get rid of it. The same sort of thing happens in your ear canal. It starts collecting this typically whitish sort of colored stuff, and you might see a little bit coming out, and you can get yellowish and all sorts of other different colors, but a small amount comes out, and particularly if you're silly enough to try and use a cotton bud or something like that to try and clean it out. These are the things that you would get with an otitis externa. It's not huge amounts of pus that comes out, but it's one of the first things. You certainly get the pus before you get the hearing loss. So you get the pain first, typically. It starts swelling up and starts hurting. You get the discharge, a yellowy, sort of whitish pus that comes on the surface that ends up coming out bit by bit. And then when it really closes down, you get the hearing loss. Now, with otitis media, the middle ear, as I said before, you lose the hearing first, and then the pain comes on because it's filled up that middle ear space. It's pushing on that eardrum. And then at this point, there's been no discharge at all. You've got the hearing loss, you've got the pain. It's really, really deep, boring pain, not pain when you touch it. And then all of a sudden, when the pressure's too great, it tears through the eardrum. All this pus and blood initially will pour out of the ear, and you'll think, oh my God, what's happened here? And all this stuff will pour down and ruin your pillow. It'll be all over the place rather than just a little spot here and there. It'll be all over the place. And then that's the time when you see blood and pus pouring out of the ear. You think, oh no, this is terrible. What's happened to my son or my daughter, or what's happened to my partner, something like that. And you take them straight to A&E. But actually, at that point, all the pus has come out, and within a couple of days, you should feel a lot better. Once all this stuff is poured out and the pressure's come off, often within a few hours sometimes, people say, actually, I feel a lot better since all that pus has come out, and you feel so much better because it's torn through my eardrum and all of it has come out and the pressure's come away, the pain's gone away. The hearing is still bad because you've just torn the eardrum. But the good news is, as long as the infection goes, about high 90s, 98% of people will repair their eardrum normally within 3 months, and the hearing comes back at that point. Now, there are complications, and there are people who don't get their hearing back and don't have the hole stays there and it doesn't heal up properly, all those sorts of things. But generally, in a typical case, you get hearing loss first, then the pain, and then it tears with blood and pus, pours out loads, much more than otitis externa, the ear canal infection. And that's what an otitis media looks like, a middle ear infection. However, otitis externa, you get the pain first. Then you get a little bit of wispy bits of pus, not as much as the otitis media, it doesn't just pour out. You very, very rarely get blood that way. And then you start losing your hearing as it closes up your ear altogether. And it's very, very tender to touch like this, where you don't get the tenderness. So I'm just recapping for you, just in case. Now, there are slight other differences as well about these two different types of infection, but those are the main ones. Those are ones we think about when you see a doctor. You go, okay, I'm trying to figure out what it is. Now, a lot of us cheat and just look in the ear with an otoscope and things like that, so we can see exactly what type of infection you have. And if it's a middle ear infection, you tend to see the eardrum bulging forward towards you. Sometimes you can get just fluid behind there, or sometimes you get white pus behind the eardrum, or sometimes you see it later on and it's torn through and all this pus is pouring through, and then slowly you're going to start healing up over the next few days. Otitis externa, when you try and put it in, it really, really hurts. And then you realize that the lining of the ear canal is all swollen red and raw. And it just looks very, very bad. But the eardrum itself looks normal. So that's why you can tell roughly between otitis media and otitis externa by looking in the ear. But not many people have that option. Some people use these ear cameras and things like that. Just be careful of that, because sometimes that can cause an external ear infection. So you don't want to look in there with otitis media and then cause yourself otitis externa on top of that. So just be a little bit careful when you're using those cameras. Some people may say at this point, okay, I've figured out I've got otitis externa, or I figured out I've got otitis media. How do I fix these things? And it's complicated. But what I'll do is I'll give you a brief summary about how to fix each of these two, because it actually is a lot more difficult than it sounds. Otitis externa should be treated typically with 4 things, the way I think about it in my head. The first thing is, if you are able to see an ear surgeon or something like that, we need to clean off all the pus that's sitting on your ear canal. Because what we really want to do is put antibiotic drops within the ear to stop, to get to the ear infection and calm down the infection on top of that area. It's like putting like a topical antibiotic over a red raw area on your arm. Now, if we don't clean that stuff off and it's just got pus all the way around, when you put the drops in, well, it doesn't actually percolate through that pus, and it just treats the pus. It doesn't really treat the underlying infection. So often we say, look, if you've got an ear full of pus, not huge amounts like otitis media, but just on the surface of the skin, the drops that you put in there aren't going to solve the problem, because it's not actually getting to the underlying infected skin. So what you really ought to do is clean that stuff off, and then when you put the drops in, that's how you can heal this up quickly. And typically we give something, we call them aminoglycosides first, for about up to 9 to 10 days in the first instance. And if that doesn't work, you move people onto a ciprofloxacin drop. That's how we do it in this country. It's different in other countries. And there is another video, which I'll put up here, which explains ear drops better. It tells you how to put the drops in your ears as well. So for antibiotics, it will go through that, and the risks of using different types of antibiotics with others, the correct technique of putting drops into your ears. So look at that video for that. I said there were 4 things, and I've talked about 2, antibiotics and cleaning the ear out. The other thing is using an acid, because earwax is there to protect your ears from infection by being slightly acidic. It's a bit like stomach acid, killing off bugs in your stomach when you eat things. It's the same thing. Earwax is slightly acidic, and it coats the inside of your ear canal, and it slowly comes out bit by bit, so it gets rid of debris that might be stuck in there, but it's transported out all the time. But also, it's slightly acidic to kill off any bugs that might be in there. Now, if you clean out the wax a lot, so this is a way to prevent you getting infection. So if you use cotton buds and scrape that skin that transports wax out, that's going to cause an infection. If you keep scratching on your hand, eventually you'll get an infection, same sort of thing. And also you're getting rid of the wax, which is protective against infections. So if you're swimming, for example, it's called swimmer's ear, otitis externa. If you're swimming a lot and all this wax keeps coming out, eventually you're going to get an ear infection, because that's what happens in these situations. So trying preventing an infection was quite useful. But if you have an infection, using an acid seems to be beneficial, particularly for the very mild cases of otitis externa. So if you're prone to infection, say you're a swimmer. So apparently a lot of Olympic swimmers, when they swim, after every training session, they spray their ears with this thing called ear calm, which is basically acetic acid vinegar. And they spray their ears with ear calm to prevent themselves from getting an infection later, because when they get an infection, they really can't train anymore. So they need to keep going. So if you're prone to getting these infections, use this ear calm spray, acetic acid vinegar, and it will protect your ears from getting infected. Now, the fourth thing is a steroid drop. And what it does is reduce the swelling in your ear to stop it from getting infected. Well, it doesn't stop it from getting infected. It just treats some of the pain and the swelling, and that can help with infections as well. So, in fact, our national guidelines often say that if you have a very mild case of otitis externa, no pus, just a little bit of swelling, and you can tell it's pain, and when you pull the ear and you know it's an otitis externa, you can see the redness inside the ear, then you think, well, I don't really want to give antibiotics, because if you look at that video again, it tells you all the risks of giving antibiotics, getting fungal infections, hearing loss, and things like that. But to try and avoid that, you could either give an acid, ear calm, or you can give betnosol drops, like a steroid drop, to try and calm that area down, and then hopefully you can get rid of the infection that way. That's what we normally do for the mildest cases of otitis externa. If it's bad enough that you need to clean it out, you clean it out. And often we give antibiotics on top of that. So you end up taking uh, a drop which has antibiotic, a steroid, and acid in it. Something like Otitis is really good in the first instance, which has all three together. And if you could get to see an ENT guy, they can clean out your ear as well, so it works quicker. If it doesn't work, as I said, you'd swap it over to a ciprofloxacin drop. Sometimes we use it as eye drops, but we use it in the ear instead. But often these ciprofloxacin drops don't have an acid in it, or they don't have a steroid in it. So you have to add those. So 3 separate drops in your ears. And again, I'll put that video up again one more time. And it tells you how to put the drops in, because it's a real hassle if you don't do it right. If you don't lie down properly, if you don't hold it there for long enough, all those sorts of things are in that video. If it's so closed up in your ear and it's closed down so you can't get the drops in at all, there is something known as a Pope Wick. It's basically a bit of sponge, a closed up bit of sponge. And what we do is really, it's horribly uncomfortable. We push this thing into the ear canal, push it past the swelling. It really, really hurts when it goes in, because it's quite hard, this bit of sponge. And once it's in the ear canal, forced its way in, scraped past all this really sensitive tissue, then we put some drops on that. And what happens is, with this sponge, it opens up like this. So the drops actually get down to the bottom of the ear canal. If you just put it here and it just slides down the side of your face, it's not going to fix anything. So if you want to get the drops right down to the bottom, sometimes if the ear is closed up altogether, we would put this ear pope thing in, or Pope Wick in, and when the drops go in, they touch the top of the sponge and they percolate all the way down to the bottom of the ear canal and treat the whole ear canal. You can't leave that in for too long. It's like leaving a tampon in for too long. You actually have to remove that Pope Wick after a couple of days to stop you from getting it itself becoming an infected source. So, but after a day or so, you can take it out, and the ear canal has started opening up a lot more. The inflammation has come down, and you feel so much better when the ear canal is so swollen that you can't see anything through it. Those two membranes touching each other is really painful anyway. But you do have to go through the close to agony of pushing this thing past all that inflamed tissue. But it really helps. It really sorts things out. In the old days, we had something called Glickwick, which was this sort of tar type substance, which would shrink everything down within half an hour. But I don't think you can get it anymore. Some manufacturer just stopped doing it. But it was amazing. It would just solve a lot of problems, and the pain would go away instantly. But I guess the pharmaceutical company, felt it wasn't worth making anymore. Anyway, otitis media. What do you do if you have an otitis media? In the very early stages, with this as middle ear infection, you can't hear very well, I would try as best you can to pop your ears. Now, a lot of people are scared of that. They're really scared that they're going to tear their eardrum or something like that. But that might happen anyway. And to be honest, if you're going to, the best case scenario is that it comes out the Eustachian tube, and that would be brilliant, and all that pus will go away that way. Often that doesn't happen. The next best thing is for it to tear through the eardrum. And it sounds like, why is this guy saying this? But tearing through the eardrum, because the vast majority heal up anyway, that might be the best thing for you. It very, very rarely happens. If you're trying to do this like this, and you just feel it coming on now, and you get this crackling sensation when you pop your ears, then popping your ears is the right thing to do. Because if you let it go too far, it may not tear through the eardrum. It may find a different hole to end up in. It might go through the thin bone that goes from your ear to your brain, and nobody wants a brain abscess. Or it might go into the little membranes that go into the inner ear, where we haven't talked about inner ear infections at all. But when it goes into the inner ear, it can damage your hearing permanently. It can damage your balance permanently on that. So I'd much rather it tore through the eardrum rather than one of those other places, because that's often permanent damage. And often you need an operation and everything to fix it. So if you feel that you've got otitis media coming on, you've been through this problem before, pop your ears, blow your nose against the forcibly pinched nostrils. And so the air can't come out your nose, ends up going into your ears, and your ears pop. Because what you're doing is you're pushing air through the eustachian tube into that middle ear space. Now, it hurts, obviously, because you're putting more pressure inside there. But what you're doing is you're replacing the fluid in there for the air that you just pushed in. So if you saw, when you look in there with your otoscopy, you look in someone's ear, and they do this maneuver, it hurts, but you can see bubbles coming up, and all the bubbles are coming up and replacing with the fluid coming out of the eustachian tube. If you look in the nose at the same time, you'll see like all this stuff pouring out and horribly, and they taste it sometimes if they really get a good pop, and all this stuff keeps coming out. That will hopefully prevent you going from a little bit of ear hearing loss to the pain section, which starts pushing against your eardrum. Now, if you got all the way to the point where you've lost your hearing and now you're getting the pain, if you can't pop your ears, that would be great. But there would be no point about you putting drops in your ears in this situation. If you're not getting discharge coming out of your ear, it means that the eardrum is still intact. It hasn't torn through, no blood or anything has come out. And so there's no point putting drops in that way. If you are what we would call systemically unwell, that means the infection is making you feel hot, you feel sick, you feel feverish, all those sorts of things, and you've got a proper infection going around your whole body, then taking sometimes oral antibiotics may help. Oral antibiotics do nothing for an otitis externa. It's pointless. So if you've got an ear infection of the skin here, pointless doing that. It is sometimes recommended for an otitis media, so a middle ear infection, because putting drops in is not going to do anything. But if the infection is starting to spread through the rest of your body, using antibiotics to prevent that from happening can be useful. Only when the eardrum tears open and all this pus pours out and the blood pours out, that's when you put drops into the ears and let the drops go through that hole and fix the infection in the middle ear. It doesn't really do much to the pus, as it were. So what we normally do is clean out the pus, seed the hole in the eardrum, and then put drops through that hole. And you know that within a couple of days, things will start getting better again. They start getting better again anyway, because all the pus has come out. But if you're really worried of an ongoing infection in that area, you can put drops in there. So I talked a lot about antibiotics and acid and stuff like that for otitis externa. Not such a big deal for otitis media, because once the pus is drained, it just gets better. But sometimes if it starts spreading past your ear, you need some antibiotics. But if you can avoid it from happening by just popping your ears, it solves all sorts of different problems and prevents you from tearing your eardrum in the first place if you can get there early enough. It can get rid of the pain if you can pop your ears and not tear your eardrum. And even if you did tear your eardrum, as you know, it will heal up anyway. This is not a guide for you to fix yourself at home. If this is for a bit of education, and so you know what to say to your GP, your ENT doctor, so when they ask you questions, you sort of sort it through. Don't try and treat this by yourself at home. To get antibiotics and all these things, you need to go and see your doctor. And once you've seen an ENT doctor and he said, yes, you keep getting otitis externa, keep getting otitis media, these are ways to avoid it, then actually, I didn't talk about how to avoid otitis media. Otitis media is often caused by the eustachian tube. Remember that the tube that goes from your nose to your ear. That if people who can't pop their ears, those are people who get otitis media. So if you can't pop your ears, there's nowhere for that fluid in your ear to go, and it starts building up, and then it gets infected. So try and pop your ears as much as possible. And I've got loads of videos on eustachian tube dysfunction. There's a grommet insertion, there's a eustachian tube balloon where you clean it out and solve the problem for good, and all sorts of things about that. So think about that as one option. Just keep popping your ears. So if you have a child who has what we think are repeated infections of otitis media, middle ear infections, then that's something that you can sometimes reduce the number of risk factors around that child to stop them from getting these infections. One way is to not smoke around them, even passive smoke. And some people say, well, I always go outside and smoke. Actually, that apparently is not good enough either. If you go outside, have your cigarette, vape, whatever you want to do, you have your cigarette outside, you need to change your clothes outside and have a shower outside before coming back in, because it's going to be in all your clothes and when you give your child a hug. So honestly, if you're worried about your child's hearing, you should stop smoking. And this may cause some arguments amongst parents out there, but the evidence is clear. If there's someone at home who passive smokes, even if they go outside and stuff like that, stop them from smoking, and it tends to get better pretty quickly. They don't get so many infections because smoke seems to reduce the amount of the activity of the cells cleaning themselves out in the ear and in the nose and things like that. And it really affects children quite a lot. So if you really care about stopping your kid from getting infections, you need to try and stop smoking. That's just an obvious thing. The other thing is how sometimes children, when they're giving their bottle to drink or whatever sort of juice or milk that they drink, they sometimes give them the drink lying down flat in bed, so sort of drinking like this before they fall asleep. It's not a great idea, purely because the eustachian tube, that tube that goes from your ear to your nose, is in a slightly different angle when you're a baby boy or baby girl. And sometimes when you drink like this, it goes straight into the eustachian tubes, and you can get infected eustachian tubes because of the milk just pouring right down to the back of their nose. So just be a little bit careful of that. Try and sit them up at least 45 degrees rather than let them sleep on their back. Um, it seems to reduce the number of infections these children get, so sit them up as much as you possibly can. Now, there are things you can do also to prevent eustachian tube blockages and otitis media. Breastfeeding, I think a lot of people would prefer to breastfeed, but it's difficult for them. But if you can breastfeed, do breastfeed them for the first 6 months. That seems to help, 4 to 6 months. That seems to help with protecting a child's immunity and also eustachian tube dysfunction, protecting against that. There's also going to nursery. Now, it's pretty hard. You know, in this society, mums and dads are all going to work and kids have to go to nursery. But if you've got the choice and you're worried about your kids hearing, then if you don't have to send them to nursery, then it might be worth trying to avoid that as best you can until they've grown up a little bit, because once they're a little bit taller, bigger, the eustachian tube correspondingly is larger. It's less likely to get blocked. The same thing happens with flights. You know, when you're on an aeroplane and you're about to land, typically landing, sometimes taking off, all the kids start screaming because they can't pop their ears because their eustachian tubes are titchy and very small. They can't pop their ears very easily. And so they all start screaming because they get pain in their ears, and then they get infections and they ruin the holiday. So it is quite scary. So in these situations, do think about before you go on a holiday with small children, because there is a chance that it may cause real damage to their ears. I'm not saying you shouldn't go on holiday, but just be mindful. Particularly if your child keeps getting ear infections, just be careful of that. You may cause them another infection whilst you're out there, or pain or suffering. I guess the other thing is vaccinations. Make sure the child is fully vaccinated, eating well, sleeping well, all those sorts of things. Good, healthy things that all mothers are taught to do. So be mindful of those things. Now, there are lots of different infections of the ear. There's, as I said, the ear infection here, ear infection of the eardrum, which starts with hearing loss. You don't really get much pain, and even when you get pus coming out, it doesn't seem to improve the hearing, and that's called a Myringitis. You can get infection of the inner ear, so you lose your hearing, or you get very dizzy, and all sorts of things happen. So there's loads of different types of infection, but I'm not going to go through all of those because actually it's quite complicated. And if you're interested, let me know, and I'll do those sorts of videos. But hopefully this has given you a little bit of help in understanding what sort of infection you may have or your child may have. I'll put that video up again about ear infections. There is one thing I ought to say, is that you might get a situation where you keep putting drops in, but the infection, otitis externa, typically non-painful discharge coming out of your ear, keeps happening. Yeah, it looks like an otitis externa, according to, say, the GP or someone like that. And it says, oh, it looks like an ear infection, take some drops, but it's not that tender, but there's still a little bit of discharge, not huge amounts. And it doesn't cause huge amounts of pain. So it seems a bit odd compared to what I've just been saying now. Sometimes that's a cholesteatoma. A cholesteatoma is it's a collection of cells that keeps growing. It's not a cancer as such. It's not going to spread and cause, horrible things like that. But it is a collection of cells that sort of wraps itself around each other and getting bigger and bigger and bigger, causing local damage to the bones of hearing, the eardrum, and also other structures in the ear. So it's quite hard to see these things sometimes unless you're really looking out for these things. If you're constantly getting ear infections and you use drops and it gets better, then it comes back again. It doesn't really hurt, but it keeps causing a little bit of discharge, and you don't have a hole in your eardrum, you may have a cholesteatoma. So do see your GP or ENT doctor, and they'll just check that top corner where these cholesteatomas tend to come. Sometimes you need to have a scan. It's very rare, to be honest, but sometimes it's hard for people to see. Sometimes it's under some crust, like wax, inside your ears. So you have to have it cleaned off before you can see, oh, wow, there's a big hole in that attic area. We need to clear that out. There is a great, an amazing YouTube channel, Durham hearing specialist, called him Conor. Conor Boland, sorry. He's got a wonderful, wonderful YouTube channel which looks at lots of people's ears. And there's a lot to learn about ears there. He does a much better job than I ever could on that. So look at his YouTube channel. All those videos are there. So I wish you all the best. Do take care. Bye bye.